we're going to start with a complete physical assessment. And the first thing I want to do is take a look at your face. And I'm going to look at your face and make sure it's nice, round, symmetrical. And I don't see anything there. That looks fine. I'm going to remove your cap. And I'm going to take a look at your hair. We're just going to take a look at the distribution, the color, the texture. And I'm going to look inside your head, make sure there's no lesions, no infestations or depressions, and all that looks fine there. Okay. And I'm going to go ahead and palpate your temporal arteries just for tenderness. All right. And next we're going to palpate all your lymph nodes. Now start with your pre-auricular lymph node, which is right here, and your post-auricular, which is like right behind your ear. Then we're going to go to your tonsillar, which is down a little bit below. Then your occipital, which is right behind your head back here. And that's nice. I don't feel any tenderness or, now we're going to go up under your submandibular, which is right here, lymph node. And that's nice. It's not swollen. Okay. And then your submental, which is like right up under your chin area. That lymph node looks fine. Feels fine. Now I'm going to palpate your superior cervical. Okay, and that lymph node feels fine. And your posterior cervical. It's right back here. And right above your clavicle, we're going to do your supraclavicle lymph node. Okay, and that lymph node feels fine. All right. The next thing I want to do is palpate your masseter muscle, which is right here. And as I palpate this muscle, I want you to clench your teeth. All right, good, good. Now, I just also want to test your soft sensation to touch. So I'm going to use something real soft here, and we're going to, and I want you to let me know, I'm going to use this little piece of cotton tip, and I want you to let me know, can you feel it, okay? Can you feel that?
Yes.
Can you feel this?
Yes.
Okay, here?
Yes. Yes. Yes.
All right, very good. Now we're going to go ahead and start with your ears, okay? I'm just going to take a look at your ear, take a look at the color, the size. Looks fine. Make sure it's nice and symmetrical. I don't see any lesions. I'm going to palpate and touch around your peanut area, which is like right above your earlobe right there. And also palpate this side. And also I want to palpate your tragus, which is right here. And that feels fine. Good. All right. The next thing we're going to do is assess your hearing. And the first test I want to do is the whisper test. I'm going to whisper a number and a word, or either a number and a letter. And you just let me know what it is that I whispered to you, okay? Just going to stand behind you.
A2.
Okay, very good. Now I'm going to come on the other side. I'm going to whisper.
B1.
All right, very good. Now the next thing we're going to do is the Weber test. I just want to test and see whether or not your hearing is equal on both sides and you don't have any hearing loss. So I'm going to strike this little tuning fork and I'm going to place it right there on top of your forehead and let me know whether or not you can hear the ringing equally in both ears, okay?
Okay. Yeah.
Okay, very good. Now, I'm going to tap this tuning fork again, and I'm going to place it right behind your ear, right there in your masseter bone, and you let me know when you hear the ringing. And then when it stops, let me know when it stops, okay?
Okay.
And I'm going to place it right there, right by your ear, and let me know when you hear the ringing again and when it stops, okay?
Okay.
So we're going to try it now.
Started and it's still ringing. Stop. Still ringing. Still ringing. Stop.
Okay, well good. That let me know that your air conduction is greater than your bone conduction, which is good. Alright, so the next test we're going to do is, first of all, I'm just going to take a look here at your eyes. I'm going to look at your eyelashes and your eyebrows. I'm just going want to look there, make sure you don't have any lesions, and that's nice and symmetrical, looks good. I want to take a look at your sclera. I'm going to look at the color there, and I'm going to pull your eyelid down here and look at your conjunctiva. Okay, that's good. I don't see any lesions, and your color looks fine. Okay, the next thing I want to do is test your pupillary reaction to light. And I'm going to take this pen light and I'm going to shine it in your eye, and I just want to see, do your eyes, do you accommodate to the light, okay? So I'm just going to shine the light here. Now you just look straight ahead. I just want to see, do your pupils react to light? Okay, good. Got a good reaction there. Okay, good. All right, and the next thing we're going to check is, I just want you to take a look at me. I want to just check your gross vision. Can you see me okay? Is there any blurriness?
No, I can see.
Okay, and what color jacket I have on here?
White jacket.
Okay, very good. And I want to test your central vision. I'm going to give you something to read. Can you read these numbers right here to me?
2843.
Very good. All right, now I want to test your peripheral vision, okay? And what I'd like for you to do, we're going to do the cover and uncover test. So if you'll cover your right eye. All right, now I just want you to look straight ahead at me. And I want you to let me know when you see my fingers coming through. But keep your eyes focused on me, okay? Because we're just testing your peripheral vision. So let me know when you see my fingers. Okay, keep your eyes focused to me. Keep your eyes focused to me. Okay, keep your eyes on me. Alright, now we're going to do your other eye, okay? Now use your other hand, cover that eye, and let me know when you see my fingers coming towards you. Okay? Alright, good. Good job. Alright, the next thing we're going to do is do a little bit more testing with your vision. The next test is extraocular movement, and I want you to just follow my fingers, okay? And then just testing some of your other cranial nerve functions. Okay, very good. Now I just want to check and see whether or not your eyes accommodate and converge. And what I want you to do is take a look here at my finger, and as I move it towards your face, I just want you to continue to follow my fingers, okay? Okay, good. All right. Now, the next test we're going to move on. I just want to take a look here at your nose, and just make sure your nose is nice and symmetrical. I don't see any problems there. Take a look at your nasal area, make sure that's open and nice and patent and it's good. And I want to palpate your temporal sinus. Okay. Now I want to palpate your maxillary sinus. And they look nice and no tenderness. I don't feel any type of enlargement there. Okay, now we're going to move on to your mouth. Now I'm going to use my pen light again when we get to this area here. Just going to take a look at your lips first again, look at your color. Now I want you to open your mouth for me. I'm just going to take a look back here. Okay. All right. I see you got a nice buccal mucosa. Looks fine. All right. Posterior pharynx. Should say eye for me. Okay. Tongue looks good. All right. I don't see any problem lesions or anything back there. Good. All right. All right. That was good. So now we will move on. I want to test your TMJ joint that located right here, your tibulomandibular joint here. So what I want to do is put my hand right there, and I want you to open and close your mouth. Okay, and you close. All right, any pain or anything when you do that?
No.
Okay, I don't feel any crepitus or anything like that. So your TMJ, that joint is intact. That looks fine. All right, and I did forget to test one of your other cranial nerves. So I just want you to smile at me, frown, okay, lick your tongue out, all right, and puff your jaws out like that. All right, good. Raise your eyebrows. All right, great. Okay. So next, what we're gonna do is move on to your neck. I want to take a look here at your neck. Look at your trachea. Make sure it's nice and midline, and it is. I'm gonna palpate your thyroid gland over there, if any tenderness is swelling, and that looks fine. Okay. Next, I want to palpate your carotid arteries. That feels fine. Fine. Okay, next I want to listen to your carotid arteries and make sure I don't hear any bruits. So I'm going to take my stethoscope here and I'm going to listen to your carotid artery. All right. That sounds good. I'm hearing the bruits, anything there. Okay. Next, we're going to do some range of motion to your neck, okay? So if you will flex your neck down like that for me. Okay. Now I want you just to extend your neck back up. All right. Now I want you to just rotate your neck to your left. Look to your left. All right. Now I want you to just look to your right. Rotate your neck to your right. All right. We're going to do lateral bending where I want you to, on your right side, just try and make your ear touch your shoulder. Just go down as far as you can on that side. All right, good. Now we're going to do the left side. Try and make your ear touch your shoulder. All right, very good. Now I'm just going to put my arm on your shoulder and I just want you to shrug up against resistance, okay? And you can try to shrug up against resistance. Okay, good job. All right, so the next thing we're going to do as we move on, I want to check your respiratory status. And first thing that I want to do is just take a look at you first. Just take a look at your breathing. Make sure you're breathing nice and normal. I see you are. I don't see any signs of distress. No use of accessory muscles. No nasal flaring. Your position is nice and symmetrical. I don't see any typhoid positioning or positioning that's not symmetrical. All right. So first I'm going to start off. I want you to sit up a little bit, and I'm going to start off from the back. I'm just going to look here at your back again from the posterior view. Okay. And first I want to check for chest expansion. And what I'm going to do, I'm going to take my hand, I'm just going to put it right here behind you, and I just still want you to just breathe normal. I just want to make sure that your chest is expanding like it should. Okay, good. And next I want to check for tactile firmitis, and I'm going to put the palms, you just relax. I'm going to put my palm of my hands in certain places on your back, and I just want you to say 99, okay? Okay. Say 99.
99.
Good.
99.
Good.
99.
Great.
99.
All right, very good. And now I'm just going to palpate certain areas of your back, okay? Can you just sit up a little bit for me? There you go, and just relax. All right, now we're just going to palpate certain areas on your back. Okay, very good. And the next thing that I'm going to do is I'm just going to listen to your back, from the back, okay? I'm just going to take my stethoscope and I'm going to listen to you. Take a deep breath. Good, and out. Another deep breath in. Okay. Okay, and now while I listen to you, I want you to say 99, okay?
Okay. 99. 99, 99, 99, 99, 99.
Okay, now I just want you to whisper 99, just in a low voice like that. Okay, and now I want you to say E.
E.
And again.
E.
And again.
E.
And again.
E.
Okay, good. And now I'm going to start from the front anterior view. And I'm just going to listen to your lungs and just go over some different tests of your lungs from the front view. And first, we're going to start off with chest expansion again, like I did the back. So I'm just going to put my hand, you can relax, I'm just going to put my hand right here. And I just want you to breathe normal. Okay, good. You got good equal chest expansion there. And I'm going to check tachyphylaxis again. I'm going to put the palms of my hand on your chest, and I just want you to say 99.
99. 99. 99.
All right, good. And now I'm going to listen to you. It's going to kind of move here for a little bit here. Okay, good. And now we're going to start with your cardiovascular assessment, okay? And I'm first start off by listening to different areas of your heart. I'm starting with the different valves. And first we're going to start out with the aortic valve, which is located on the right sternum border, second intercostal space. And I'm just going to listen to your heart here. Okay, now we're going to move to the pulmonic valve, which is the second intercostal space, left side. Now we'll move down to the Erb's point, which is about the third intercostal space, left side. Move on down to the tricuspid, which is the fourth intercostal space, left side. And now I'm going to move over to the mitral valve, which is about the fifth intercostal space, left mid-clavicular line. Okay, and I'm going to listen to your heart here too for about 1 full minute, because this is the point of maximal impulse, where I can get an accurate heart rate and rhythm. Okay, good. All right. Heart rate, sign and rhythm. Heart rate is about 85. So that is good. Okay. So the next thing, we're going to move on to your abdominal assessment. And what I'm going to let you do is sit back in a recliner chair. We're going to kind of recline that back so you can be in a better position. move this chair right here back. And you can get up for a minute, and I'm gonna push this chair up some, okay? All right, now I'm gonna let you go ahead and sit back, and we're gonna recline all the way back. I'm just gonna let this back here. I'm just gonna let you all the way back. Now, first I'm going to go ahead and start with your abdominal assessment. And I'm just going to take a look here at your abdomen, make sure it's nice, it's symmetrical, and it looks fine, the contours is good. I'm going to start off by listening to your aorta, just to make sure I don't hear any bruits or anything there. And that's located above your umbilical area, around in the abdominal area. So I'm just going to listen here. Okay, I don't hear any bruits. And I'm going to listen to your renal arteries, which is right on the side here, and around your abdominal areas on each side, the left and right. Okay, I don't hear any bruits there. Now I'm going to go to your iliac artery, which is down below your abdominal area. Okay, and I don't hear anything there. Don't hear anything there. Now we're going to go to your groin, okay? And I'm just going to listen here. And this is your femoral artery. And I don't hear no bruits there. I'm going to listen here. Okay, and I don't hear any bruits there. Okay, now I'm just going to listen to your bowel sounds in your abdominal area in all 4 quadrants. Okay, and now I just want to percuss this area. Okay, good. And now I'm just going to palpate your abdomen. Just make sure you don't have any type of lesions or any type of abnormalities there that I feel, or hard areas in your belly. So we're just going to palpate. Okay. And now what I want to do is palpate your liver, okay? And the technique that I'm going to use to palpate your liver is called a hooking technique. It's because the people whose bellies are a little distended, it's kind of hard to palpate their liver in the position that is commonly used. So I'm just going to use the hooking technique. Now I'm going to stand right here to the side, and I'm going to use my hand. I'm just going to kind of like push down right here in this area. And then when I push down, I just want you to take a deep breath, okay? And just try and relax. So count of 3. 1, 2, 3. Just take a deep breath and try and relax. Okay. All right. And let's try that again because I really didn't feel anything. Okay. Take a deep breath in and relax. Okay. Well, that's still didn't feel anything, but that's good. At least I know that your liver's not distended. Now I'm going to come on this side and I'm going to palpate your spleen. And I'm just going to palpate here. Just take a deep breath of me. Okay, and relax. And good. I don't feel anything there, so that's very. All right. So the next thing I want to do is we'll go ahead and let you back up. Well, no, while you actually in that position, I'm just going to take a look here at your jugular vein, okay? Just make sure that's not distended. Okay, good. See anything there, and I'm going to let you up. Okay, then I'm going to take a look at your jugular vein there while you're sitting up. That looks good. That looks good. I don't see any distension there. Okay? And now since we're gonna start working on your extremities and doing a little range of motion, I'm gonna let you come back to this chair because I think you got better positioning in this chair here. So you can get up for a moment. And we're gonna push this back here and I'm gonna let you get in this chair. Okay, you can have a seat there. Okay, good. All right. Well, the first thing, good. Okay, first thing with the extremity assessment, I'm gonna let you go ahead and take your jacket off here when we do this part. Okay. So you can just, your sweater, you can just take that off. All right. And first thing I want to do here is we're gonna take a look at your fingers. I see your fingers here, all right. And I just want to start off by looking at the color of your fingers. Make sure the shape is nice and symmetrical. I don't see any lesions. Okay, no nodules, anything like that. I'm gonna check your capillary refill. Fingers, that looks good. I see that one. It's good. Capillary refill is good. I'm gonna check your radial pulses. That's great. Check this one. Okay, now we're gonna do some range of motion with your hands, okay? First we're gonna, with your fingers, first we're gonna do flexion. And what I want you to do is just make a fist. Okay, now we're gonna do extension. You just open your hands up. All right, good. Now we're gonna do adduction, which you just add your fingers back to your body. Great, and now we're gonna do abduction, which you just take your fingers away. All right, good. All right, great job. And next, I'm just gonna take a look here at your wrist. Make sure your wrist is nice and there's no nodules, lesions, or anything like that going on with your wrist, and that's good. Now we're gonna do range of motion with your wrist, okay? Now I just want you to flex your wrist down like this, all right? And extend your wrist up like that. Okay, now we're gonna rotate your wrist towards your body. Okay, and that's inversion, and rotate your wrist away from your body. Exversion, all right, very good. Okay, now I'm just gonna take a look at your elbow here. Make sure your elbow, get the color, nice and symmetrical, no problems there. Good, okay. And now we're gonna do some range of motion with your elbow. I want you to flex your elbow up. All right, and extend your elbow back down. Okay, and now I'm gonna let you flex your elbow up, but I want you to do it against my resistance, okay? And flex your elbow up. Good. Keep it up. Then extend your elbow down against my resistance. All right. Great. Now we're going to move on to your shoulders. Just going to take a look at your shoulders. Make sure it's nice and symmetrical. Everything is aligned there. And we're going to do some range of motion with your shoulders, okay? First thing, I want you to extend your arms out like that. Okay, great. Now, and that's flexion, it's flexing it out. Now I want you to extend it back behind you. Okay, good. And now, abduction, I just want you to extend it away from your body. Okay, and that adduction, I want you to just bring it in towards your body and over your chest. Yeah, good, just like that. Okay, good. Now I just want you to sit up a little bit, and we're gonna do internal rotation, where you're just gonna put your hand behind your head like you're stretching your head. Just stretch it back. Okay, good. Now we're gonna do external rotation, where you're just gonna take your hand and put it and touch the scapula towards your back area. All right, good job with your shoulders. Okay. Now I just want to also test light sensation to touch by using that cotton swab again, and I'm just going to touch different areas on your extremities, and I just want you to let me know whether or not you can feel it. Okay. So I got this piece of cotton ball again. Just let me know whether or not you can feel this.
I feel it. I don't feel it. I don't feel it. I don't feel it. I don't feel it.
All right, good. Okay. and now I just want to test your vibration sensation to your ulnar area. So I'm going to strike this tuning fork again. Now let me know if you can feel the vibration, okay?
Okay. Yeah, I feel it.
Alright.
Yeah, I feel it.
Alright. Oh, let me do the ulnar area on that side.
Yeah, I feel it.
Alright, very good. Okay. Now the next thing we're going to do, we're going to continue to move on. And I would like to test graphogenesis and also stereogenesis. Where with graphogenesis, I am going to take your hand here and I'm going to draw something in your hand, and I just want you to tell me what that letter or number is. It's going to be the letter or number, okay? Alright, now let me know what I'm drawing.
A B.
Alright, good. Now I'm going to close your eyes, and I'm going to put something in your hand. I want you to let me know what the object feels like.
A cigarette lighter, a lighter.
Okay, you can open up. Very good. Okay. Alright, and the next thing we're going to do is move on. I want to test your rapid alternating movement. And just let us know whether or not all the function in your cerebellum is intact, whether or not you may have some kind of neurological deficit going on if you're not able to do this here. First, we're going to start off with finger opposition. And what I want to do is I just want you to follow my finger here. And I need you to pay attention. I want you to follow my finger. And I'm going to move my finger to different points. And I want you to touch, okay? All right. We're ready. All right, good. Now we're going to do the flip-flop movement, where you just move your hand back and forth as fast as you can. All right, very good. Now we're going to do the finger to finger, where you just move your fingers to fingers and do your other hand. Okay, let's do your other hand. All right, very good. Okay, now we're going to start with some reflex, okay? We're going to go through and test all your reflex. And first, we're going to start off with your tricep reflex. And I just want you to continue to relax like you are. Try and let your body go limp, okay? Don't try and just try and relax. Very good. And you don't have to look, just try and look forward and just relax. And just let your body go limp. We're going to test your tricep reflex. Okay, we got a reflex in. Good. All right, now we're going to test your biceps reflex. So you just let that hand go limp again, okay? Okay, good. Got a little. Okay, now we're going to test your brachioradialis reflex. All right. And now we're going to move on and test your patella reflex. So just let your leg just relax. And just try and let your whole body go limp and just relax. Relax that leg. Okay. Sometimes you're not totally relaxed. It's kind of hard to get a reflex, but let's try this one. Just try and relax. Just relax your whole body and let your body go limp. No, relax your leg. Let it relax. Okay, got a little reflex then. Now we're going to test your Achilles reflex. And that's right back here. I'm going to go ahead and take the socks off too. Because we move on to our other part of our assessment. You know, we'll need for your socks to be off. Okay. Just try and stay relaxed. Okay, we got a little reflex again. Let's try that one. Okay, good. All right, and now I'm just going to test your Babinski sign to see whether or not you have a positive and negative Babinski. So I'm just going to take your feet. Okay, all right. But I felt a little tender. I'm sorry about that. Okay. Let's do this one. All right, good. When you flexed up. Yeah, I see your feet there. Okay. Now you can put that leg down. All right. And now we're going to move on to your lower extremity assessment. I'm going to start off by taking a look at your toes here. Okay, looking at the color, the size, some symmetry. I'm going to test your capillary refill. Okay, got a capillary refill in that one. All right, and now we're going to test your pulses. So I'm going to test your dorsal pedal pulse, the pedal pulse, and your posterior pedal pulse. Okay, we're going to come over on that side. Good pulse. Okay, now we're going to do some range of motion with your toes. Now we're going to start the range of motion with your toes, okay?
Okay.
And I just want you to try and flex your toes down. Flex down, okay? And extend your toe up, all right? All right, and abduct your toes. Bring them in together towards your body. All right, good. Now you can abduct your toes by just flexing them out like that. Okay, good. Now we're going to go with your ankle. Take a look at your ankles. See if there's any type of swelling. You can relax your feet. I got it. Either swelling or anything like that. Your ankles look good. The color thing of your ankle there looks good. Now, just one with your ankle, we're just going to flex your foot up we're going to flex your foot down like that. All right, now extend your foot up. Great. Now we're going to test eversion, where you're going to make your heel of your feet go in towards your body. Like turn your feet like that. Okay, and extroversion, where you're going to take it away from your body, going back that way. Your ankle. Okay, good. Now we're going to move on. I'm going to take a look here at your knee. And I'm just going to move your hands up. Take a look here at your knee. That looks good. Take a look here at your other knee. That looks good, okay. Now we're going to do some range of motion to your knee, okay. So for your knee, if you would just flex your knee up like this, good, and extend your knee back down, okay. And now I want you to flex your knee up against my resistance. Good. All right, great. Okay, next we're going to just go here and take a look at your hip. And we're going to do some range of motion with your hip. So if you just want to just straighten your leg, flex your leg out like that. Extend your leg out like that to the side. Can you go to the side a little bit more? Okay, good. All right, you can bring it back in. Okay. Now, against my resistance, just extend your leg out. Good. I'm back in. Okay, good. And now what we're going to do is, I'm going to let you stand up. Well, no, while you're sitting there, I forgot, it's one other thing I'm going to do. We're going to check light sensation to touch with your lower extremity. So I'm going to take this little cotton swab again that I had, the little tip. I'm going to take the little tip again, and we're going to feel sensation to touch. Let me know if you can feel it.
I feel it. I feel it.
Okay.
I feel it. I can feel it.
Okay, very good. And now I'm going to let you stand up. Okay. Just take your time. I know this chair is kind of high. All right, now I'm just going to take a look here. Let's see, come over a little bit. Okay, we're going to take a look here at your hips. Make sure that's nice and symmetrical. Okay, I don't see any problems there with your hips. And we're going to do some range of motion with your hips. So first of all, what I want you to do is, I want you to just flex your leg up. Okay, good. And then extend your leg back down. That's okay. Extend your leg back down. All right. And what we're going to do is you abduct your leg away from your body. Like that. Extend your leg out like that. Okay. And now we're going to abduct back towards your body. Just move your leg back like that. Abduct. Okay. Very good. And now the next thing we're going to do is just test the range of motion with your knee. And I would like for you to just, can you squat for me? Squat. All right, good. And back up.
What?
All right. Great. All right. So now, the next thing we'll move on to is your spine. And I just want to look at your spine for size, shape, symmetry. That spine looks good. And I just want you to bend over for me like you're touching your toes. And just stay in that position. Okay. Yep. Spine looks good. Okay, now you can stand up. I'm just going to do a little range of motion here. And I just want you to rotate to your right. Just rotate your body like that to your right. Now rotate your body, to your left, I'm sorry. Rotate your body to your left. Now rotate your body to your right. Okay, good. Now I want you to bend over towards your right. Like that. And then bend over towards your left. All right. Very good with that. Okay. Now, the next thing we're going to do is test your Rumberg sign. So I just want you to stand straight with your heels together. And close your eyes for me. And we're going to stand there for about 30 seconds. Okay, very good. Now you can open your eyes. Okay, now I just want you to try and hop on one foot for me if you can. All right, good. Now just make a couple steps going back to the chair. All right, awesome. Well, thank you so much. That'll conclude our physical assessment. Good job. All right,
Thank you, ma'am. Thank you, ma'am. Very nice being with you.